Part D prescription drug plans are a big part of your Medicare enrollment. But when do you enroll into these plans and when can you change them? Today, I'm going to go over the enrollment periods for Medicare Part D prescription plans, when you can first enroll, as well as when you can change your plan. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare Part D, which is your prescription drug plan. So when you do your Medicare enrollment, there's a few different parts to think about. It's Medicare Part A, Medicare Part B, a Medicare Supplement plan, and your Part D drug plan. And Medicare not only separates all these parts of Medicare, but they're actually different enrollment periods based on which part of Medicare you need to enroll in. So I'm going to talk about the different Part D enrollment periods, when you can first join a drug plan, when you can drop a drug plan and change your drug plan, because you can change them every year. Before we get started, if you find the information in this video helpful, I'd appreciate it if you would give it a thumbs up and subscribe and leave a comment down below, and we can dive right in. So when we first start looking into Part D drug plans, a great place to start is going to be the Medicare New Buyer's Guide. This guide details all the parts of Medicare we need to know in terms of timelines, definitions, and everything you might think you need to know is going to be in this guide because it's put out by Medicare. I've got a video where I go through a huge chunk of the book. I'm going to link it down below. But we'll look specifically at the part on Part D drug plans, and more specifically, when you can enroll in them. So you can see the first line is you can enroll in a Part D drug plan during your initial enrollment period. So when you turn 65, you're granted an initial enrollment period to get your Medicare Part A, B, Supplement, and D started. So if you're not on employer insurance, or you're coming off, you're retiring, and you want to get into Medicare as soon as you can, that's your initial enrollment period. And it is a 7-month period surrounding your 65th birthday. So it's 3 months before your 65th birthday, includes the month of your 65th birthday, and ends 3 months after your 65th birthday. So if you are starting Medicare fully at age 65, this is when you will first enroll in a Medicare Part D prescription drug plan. So you'll want to have it set up to start at the same time your Part B starts, same time your supplement starts, have no lapse in coverage. So like I said, if you're turning 65, this is your first chance to enroll in a Medicare Part D drug plan. But not everyone joins Medicare at age 65. So the next scenario that the Medicare New Guidebook points out is the general enrollment period. So the general enrollment period is going to be for someone who did not do their Medicare enrollment at 65, but also didn't have any other creditable health insurance. So maybe you didn't have insurance, you were on COBRA coverage or retiree coverage, and the plans ended, and now you have to enroll into Medicare. You're going to come in during the general enrollment period. And this period is when you can start your Part B, and the first thing you're going to do is apply for Part B. So between January 1st and March 31st is the general enrollment period where you can do your Part B application, and your Part B coverage is going to begin on July 1st. So you apply in the first 3 months of the year, but coverage will always start July 1st for the general enrollment period. That's Part B. What about Part D? So Part D happens pretty much right after. So for your Part D enrollment during the general enrollment period, you're going to apply in the next 3 months. So you're going to apply from April 1st through June 30th. And again, just like your Part B, your Part D is going to start July 1st. So you've got 3 months to apply for Part B, 3 months to apply for Part D, but they will start on the same day. Again, this is for someone who didn't have credible health insurance, or you're coming into Medicare maybe age 67, 68, and didn't have what Medicare considers to be active, credible coverage, like an employer-sponsored health plan. The next period that the Medicare New Guidebook makes reference to is the annual election period, also known as open enrollment. So the annual election period takes place every year from October 15th through December 7th. So it's the very end of the year where you can make changes to your prescription drug plan for a new plan to take effect January 1st. So starting October 15th, you can reassess your drug, see if one of your medications has changed, has gone up in price, has gone down in price, if the premium on your plan has changed, whatever it is, you can apply for a new drug plan for effective the next year. So start the new year on a clean foot with your prescription drug plan. There's also a time period where if you had never enrolled in a Part D plan, maybe you weren't taking any prescriptions and you didn't want to pay, $13 a month for a plan, you can pick up a drug plan. Now, there will be a late enrollment penalty if you never had a drug plan. I've got a video where I explained how that penalty works, and again, I will link it down below. But this is the time period where you can add, change, or drop a prescription drug plan. Every single year, there is no medical underwriting for Part D plans, so it's always a good idea to kind of reassess your drug coverage during this time frame. Now, if you're in a Medicare Supplement plan, although you can change your Part D plan during this time period, you have to still go through medical underwriting for a Medicare Supplement plan. And that's what I do. I assist people in finding the very best Medicare Supplement plans. You can always give me a call. My number is 833-65-JAMIE, or you can visit my website, medicarebyjamie.com, and I'd be more than happy to walk you through all the steps associated with getting your Medicare coverage started on the right foot, and there's absolutely no cost to you to work with me. So the last period we're going to talk about, it's kind of tiny at the bottom. It's going to be the special election period. So let's go a little bit further. So if you are coming off an employer-sponsored health plan, so what Medicare considers to be creditable coverage, you will qualify for a special enrollment period when you do decide to retire and leave that plan. So you're coming off your employer plan, you're going to transition right into Medicare. No penalties, without a hitch, as long as you had that credible health care coverage. So that means that once you come off your employer plan, you're going to enter your special enrollment period, and you're going to have 63 days from the end of your employer coverage to start the Part D plan. Now, that's a really important figure to remember, because when your employer coverage plan ends, you've got 8 months to initiate your Medicare Part B. But for Part D drug plans, you only have 63 days. So definitely don't wait out those 8 months and try to start both at the same time, because you're going to realize that you, probably can't start your Part D unless you're in open enrollment. And if you do, you're going to have a late penalty. So you've got 63 days from the end of your credible coverage to get started in a Medicare drug plan. I hope you found the information in this video helpful, talking about exactly when you can initiate your drug coverage or change your drug coverage. Any questions, you can always call me. My number is 833-65-JAMIE. Or you can also visit my website, medicarebyjamie.com. If you stay tuned, I'm going to give you a tour of my website and show you exactly how to request a free Medicare supplement quote. There's no cost to you to work with me. I'll go over everything you need to know about Medicare, Part D, all the applications to make sure that you have the easiest journey into Medicare as possible, because it's not as hard as it sounds as long as you've got the right information. Again, if you found the information in this video helpful, I'd appreciate it if you give it a thumbs up and subscribe, and leave a comment down below. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare Supplement plan quote. And that's what I do. I assist people in finding the best Medicare Supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.